Hi there, folks. Welcome to another episode of Dr. Crew Review. My name is Dr. Alex Keller, and I'm here with my colleague, Dr. Holly Lucille. And today we're going to be talking about Hashimoto's thyroiditis.
Yeah.
Big topic in integrative health right now, and a big issue for a lot of our patients. So, Holly, tell us, what is Hashimoto's first?
Well, Hashimoto's is the number one reason people have an under-functioning thyroid in our country.
Yes.
And it's an autoimmune disease, right? So when we think about the thyroid, getting T3, so active thyroid hormone, into each and every cell, the nucleus of each and every cell in our body, it regulates anaerobic and aerobic metabolism of all of the cells. And the process is vast, right? I've always said that a lot of times medicine isn't rocket science, but when it gets down to endocrinology, especially with thyroid, the devil's in the details. There's a lot going on. So you think at the thyroid gland itself, that's where T4 is produced. And we've never really identified a receptor site. So I would call T4 more a prohormone, and then of course, it has to be converted in peripheral tissues to T3. Right. But when you have an autoantibodies attacking the thyroid gland, you stop the production of thyroid hormone. And it's interesting with the diagnosis of Hashimoto's, because if you catch it early, because there's 4 months of stored T4, and that thyroid starts getting attacked from those antibodies, it actually looks like Graves' disease. You'll see a suppression of TSH, and you'll actually see symptoms of hypermetabolism, right? But then subsequent attacks, of course, lends to Hashimoto diagnosis. And how do we tell we run the antibodies, right? And a lot of times the gold standard in medicine, of course, for surveying what the thyroid is doing is TSH. I would say somewhat of a bunk test when we're thinking about, hey, what is that really telling us? I mean, I think it would, kick us off if there was a pituitary tumor or something. But as far as the thyroid, limited in the information we get there. And I've had this conversation with very esteemed endocrinologists in Los Angeles, where I practice. And I asked them if Hashimoto's thyroiditis, so autoimmune component of underfunctioning thyroid, is the number one cause of underfunctioning thyroid and the number one reason you prescribe Synthroid, why wouldn't you run the antibodies? And here is the reason. They wouldn't change their treatment approach. Their treatment approach, and per their scope, is still to get that TSH back within normal limits, okay? But my experience, if we don't treat the autoimmune component, the patient's symptoms of underfunctioning metabolism, so think about it, digestively, sure, there's the constipation, hair thinning. I mean, in my presentation, there's 6 slides worth of what people can go through when their thyroid is not functioning optimally, right? Yeah. And so if you don't treat the autoimmune component, it continues to travel on and the symptoms remain. And when I say travel on, I think I've seen those antibodies then and that autoimmune condition hit other glands, like premature ovarian failure, or women going into menopause way too early, 37, 38 years old. And of course, I back up and understand that they should have been diagnosed with Hashimoto's a long time ago.
Right, so it's a complicated disease.
It is.
And especially when you're dealing with an autoimmune condition,
yes,
much of what we're seeing nowadays is it starts in the gut.
Well, yeah.
Right? So you're not just dealing with a thyroid condition, you're also potentially dealing with a gut condition. Right. The gut condition can be connected to the brain. There's a whole host of interconnected.
Whole host. And when I go for treatment, docere, doctor in Latin, means to teach.
Yes. And
here, take this with Synthroid is easy medicine, okay?
Yes.
Now, if you're going to treat Hashimoto's and I have to teach my patients, this is full on. Dietary interventions, gluten-free for sure, it is in the research, okay? 60 days, 100% compliance at least. We have to drive those antibodies down. And I've got a lot of tips and tricks to do that, but it's essential. And then of course, when you say it's an autoimmune condition, where do we go? Where's the majority of our immune system lie? Right in our gut. So of course, manufacturers have great programs for gut restoration. I mean, we've got a lot of them on a Natural Partners platform, full script, the 4 or 5 or sometimes 6, 7 R's. Being able to remove antigens, of course, being able to re-inoculate with good bacteria, being able to replace nutrients that were deficient, and then being able to repair that gut tissue. So perhaps a contributing cause to Hashimoto's, like leaky gut or getting, larger food particles in there through our intestines into the bloodstream too early, your immune system's like, hey, what are you doing here? And it starts to attack, gets confused. Other contributing causes, environmental, I've seen, heavy metals, those things can kick off Hashimoto's. But our job is to definitely treat the gut, because that's where the immune system needs to fire up and get those antibodies down.
Absolutely, yeah.
Yeah.
And another component is genetics.
Yeah.
We tend to see the commonality between families having the same kind of thing.
Yeah, so it's been interesting. I've been running a lot of sort of autoimmune inflammatory genetic panels. Not that we want to treat the SNPs or what have you, but it gives us a better idea of how to get individual outcomes when you know exactly what you're dealing with. In genetics, it's pretty individual.
Absolutely.
Yeah.
Okay, so again, complicated disease,
Yeah.
which means you have to think about how you're treating this disease
Yeah.
and where you're starting. But we're going to talk about some of the key ingredients that we would use specifically when you're treating the thyroid.
Yeah.
Okay? So let's go through some of those.
So in the research, I mean, myo-inositol, especially with selenium, together in the research have been shown to decrease those autoantibodies. Myo-inositol, we used to know it as vitamin B8. We thought it was an essential nutrient. When we understood that it wasn't, it kind of lost its vitamin.
Right.
Is like its vitamin name.
So you don't see any fortified cereals with vitamin B8. Right?
Exactly, that's very true. But I love this too. Really important, a lot for blood sugar regulation and PCOS and stuff. But in Hashimoto's, to me, it's a must. I love it in the powder form. Protocol for Life Balance has it here. It's actually a little sweet because it is a sugar.
Right.
And so I just have people put it in their tea. So, with the complicated treatment protocol, sometimes compliance or adherence is affected. So anytime I can sneak something in that is going to make a difference and we can just sweeten up the tea with this, that's great. Also, like I said, selenium, thyroid the thyroid processes is selenium dependent.
Right.
But also higher levels of selenium, 600 micrograms, 800 micrograms, I've been able to get those antibodies down. These two together, and acetylcysteine, that's the sulfur derivative of L-cysteine, the amino acid. Great precursor to what? Glutathione.
Exactly, yeah.
Oxidative stress is another thing we need to think about in the initiation or contributing factor of Hashimoto's. So beautiful in this case as well. And we think about if we are removing things in the gut, we've got to make sure that we've got the liver opened up, and glutathione, very important for that. So restoring those levels. So I use that. Another thing, we think about with Hashimoto's is the Th1, Th2 balance, okay? And usually with Hashimoto's autoimmune disease, you'll see a Th1 dominance. And so plant sterols are really important in helping to balance back out, because it's all about balance, right? I always say and teach my patients, it's not that omega-6s are bad. It's can they be balanced with omega-3s, 7s, 9s? It's not that LDL is bad. Very important processes in the body. Can it be balanced with your other, lipids that are there? And the same thing with the immune system. The immune system has to go out and attack, but then it's got to be able to come back and be in balance. And so plant sterols are another thing that I use in this sort of very comprehensive treatment program.
Absolutely. I want to touch on these two products as well from Restorative Formulations. They're unique because they combine nutrients and herbs. So we don't often talk about that with other products, but really nice two products here. They've got a number of other ones as well, but the Thyroid PX is more of a nutrient-based one that's meant to help stabilize maybe early onset Hashimoto's or just support the thyroid in general if there's a tendency there. And you have also some adaptogenic herbs, and you have iris or blue flag in there, which helps with lymphatic flow. Again, very important for overall immune function.
Really nice combination synergistic product for thyroid, correct.
Exactly. And then this one, the Thyroid Calm, is more meant to reduce the thyroid stimulating immunoglobulins, where you have something like lycopis.
Yeah, so the TSHI.
That's right,
Yes.
yeah. So the bugleweed in that is shown to actually reduce that so that you have that more of a stabilizing effect. So less nutrients in this one. This one's a little bit more nutrient dense, giving you that overall combination. And this one is more meant to really reduce those immunoglobulins. These are nice, and there's other products like this as well that we carry, but they're organic certified herbs.
Oh,
so
there you go.
Restorative has a really nice transparency with its production.
It's
for the
nice to
products.
check that box, and my patients are looking for that all the time when it comes to products. So the other thing I want to say about myo-inositol, it also, I've seen it decrease TSH because it makes TSH a little bit more sensitive. It improves TSH sensitivity. And so that's another reason why I use myo-inositol all the time in all my Hashimoto's patients. And there's other things. Magnesium is extremely important. I mean, you have to look at the individual case and the big picture and what the need is, but treating the autoimmune condition and not just getting that TSH within normal limits is the key for Hashimoto's.
Absolutely. I'll mention one other thing because we don't have any products featured here, but we did another Dr. Kerr review on small intestine bacterial overgrowth, where we featured that for our program that we're talking about, and a lot of the products that go along with it. So if you're interested in learning more about how to stabilize the the gut and how that relates to autoimmune, check out that episode of the Dr. Career Review.
I have a feeling we could do any Dr. Career Review and talk about any condition that we're seeing or that's hot, and I bet we would go back to the gut anyway.
Probably, exactly, because our health starts in the gut, right?
Yeah. We had a saying in school called heal the hole that starts here and ends back there.
Absolutely.
Yeah.
Okay, well, thanks so much for tuning in to another episode of Dr. Career Review. Dr. Holly Lucille, Dr. Alex Keller, we'll see you next time.